Hi, Wayne.
Hi Femi,
So, who are you and where do you work?
my name's Wayne Reid. I'm a professional officer, social worker and anti-racism visionary at BASWA, which is the British Association of Social Workers.
Most people, when they think about the people who take care of us, they think the NHS, they think doctors, nurses. They might have some idea of the concept of social work, but they don't really know what it is. What is it?
Social work is a complex profession. There are many different aspects to it. It involves working with children and families, it involves working with young people, it involves working with people with mental health issues, people with disabilities, older people. But as you say, it very much should be seen alongside allied professions within health. Certainly. Social workers provide emergency services, for example. Social workers work out of hours and weekends and evenings. They respond to crises and emergency situations when people really need help. So I think quite often the police and health colleagues, the fire service, they're often seen as the blue light, frontline emergency services. Sadly, social workers are quite often forgot.
And if the NHS is the body that runs basically doctors, nurses, etc., who do social workers actually work for?
Primarily, they are employed by local authorities or councils or county councils in some areas. Social workers also work within the NHS, they work in schools, they might work in youth offending teams. Within that, there are lots of expectations and requirements. So I'm thinking of court settings, for example, home visits, undertaking assessments with people, working in partnership with professionals, various types of professionals. So there's various skills really that a social worker would need in terms of communication, empathy, working in partnership, understanding the law. Obviously that in of itself is very complex. But there's aspects of preventative work, for example, that social workers might do that might prevent people getting to a crisis. So when measures or interventions have been put in place, social workers and their relevant colleagues and managers would be the people who would review some of those different interventions that have been implemented to hopefully safeguard but improve people's quality of life. Yeah.
And how does one actually access a social worker? Because if you fall and break your leg, you call 999. What happens if you're having trouble with an abusive spouse, a drug addiction, child endangerment issues? How do you gain access to a social worker?
Well, some aspects of social work is governed by law, and that would be undertaken on a statutory basis by a local authority or a council. So child protection, for example, is governed by lots of legislation, primarily the Children Act, 1989, but various other pieces of legislation as well. So if a child, for example, discloses at school that they are being abused, or if a teacher has serious concerns about what's happening at home for a child, they might refer that child to their local social services office. They would then be duty bound to undertake an assessment, to remove any factors that would be of cause of significant harm to that child. A social worker would need to work in partnership with the child's teacher and the school and any other professionals that are involved with that child. And there's certain legislation and guidance which governs all of that. In terms of older people, again, some of that is governed by legislation along with mental health. Any member of the public, if they have concerns about a child or a vulnerable adult, can self-refer or make an anonymous referral. So there is a role maybe for organisations like mine, the British Association of Social Workers, to promote social work positively. The negative preconceptions from social work come from this void that there is around what social workers actually do, and people don't necessarily understand, so certain assumptions are made based on high profile cases that go wrong or situations that go wrong, but there's very little to counteract that. So if I was to compare social workers with the police force, for example, there are lots of different police shows, TV shows that have been around for years. They've provided exposure into what it's like to be a police officer. I'm thinking of, everything from Bergerac to Columbo to The Bill, all these different shows.
I'm more Brooklyn Nine-Nine, but fine.
But do you know what I mean? All these different types of police officer, whether they be white, black, male, female, all these are the types of protected characteristics that they might have and what the job entails, what the challenges are, etc. If you think about social work in comparison to that, there's very little. And quite often when social workers are portrayed in programs like Coronation Street, for example, I mean, I've not watched that for a number of years, but when I did last watch it, there was a social work storyline in there, and it very much just kind of reinforced the stereotype of a social worker will come away and take your child away, you know, ask you a few questions, maybe snoop around, and they'll just whip your child away from you. Or in other programs I've seen, they've just come out of the blue and, you know, sectioned somebody under the Mental Health Act. We do have to undertake those roles, but it's not all that social workers do. There's so much more. And I feel if we got the sort of exposure that, you know, police do, we can begin to educate and re-educate the public and professionals that we work with as well.
What are the challenges facing social workers in the UK today?
The first is around the workload pressures. Quite often social workers have huge workloads, huge geographical areas to cover in some cases. I know from my own past experience in a previous role as supervising social worker, I essentially covered the north of England, which involved a lot of driving. Obviously, whilst you're driving, you can't do very little. You have to concentrate on the road, so they're almost dead hours in a way. Other social workers may work within a local proximity, but still they might have a number of young people or adults that they need to support and work with, and extended family members and so on. So the workload pressures is one.
Is that why you end up hearing things like the 15-minute visit?
Yeah, I mean, you will hear that.
Is that because the workload is so great, you have so many different people that you have to look for, and under one person's responsibility, that you end up with just no time to spend actually with the person? Well,
I think many social workers will prioritise by risk, by risk of harm, risk of importance in terms of what's happening for that individual or their families, which is really difficult when it's people's lives at stake, you know, and quite often, as I say, the public perception of that isn't always aware, you know, that those are some of the challenging dilemmas that social workers are in. So yes, the workload for sure, and that coincides with a campaign from my organisation, BASWA, called the 80-20 campaign, which is about reversing the trend of social workers spending up to 80% of their time in meetings, undertaking paperwork, computer tasks and so on, and only spending 20% of their time with service users. So of course, you know, in anybody's logic, that doesn't make any sense. So that's a campaign that we've had running for a number of years, and there's some local authorities that have adopted that and tried to integrate that within their culture, but there's still a way to go. So the workload pressures is one. Another challenge is the working conditions. I mentioned about Joe Brand's comedy programme, Damned. If you look at the working conditions that the social workers there have to work in, my feeling was that very much reminds me of my time, you know, working in different places. In that, you know, the office furniture, for example, is quite dilapidated. It may be that people are hot desking, so, you know, when they've got all their sort of information related to the people they're working with, they're constantly having to move that around within an office space. That might sound like something quite small, but actually
dealing with confidential documents.
Exactly. Some of the other challenges that social workers face, particularly social workers of colour, is around racism, and there's no escaping that really. I know that the Sewell report recently sort of found or concluded that institutional racism doesn't exist.
Well done, guys. Well done.
But that's certainly not the experience of myself and colleagues and social workers that I speak with across the country.
So let's hit those one at a time. In terms of the workload, what would you want the government to do to address that? Do you need more funding, more staff?
All of those things. If we were to look at priorities, I guess funding would need to be paramount because of years of austerity, because of the decimation really of local authority budgets, how it's impacted on the third or voluntary sector, the rise of privatisation within social work, so essentially there's profit being made off other people's misfortune, which I don't necessarily disagree with privatisation, but I think the ethics within some organisations is found wanting. And I think there needs to be a review of the years of austerity and an injection of funding for social work and social care, first and foremost. I think there also needs to be a strong emphasis on streamlining a lot of the bureaucracy and the managerialism that exists.
That's part of the 80-20 campaign.
Exactly, yeah. And yeah, I think that really needs to be looked at. That's the sort of thing that can really unleash the chains, I think, that a lot of social workers find. And finally, there needs to be also a kind of drive on recruitment. And some of that, I think, comes down to this perception that there is of social work. We need to make it a more attractive role. It is attractive in the sense that it's very rewarding. I think most social workers would subscribe to the view that it's not a job, really. It might be a career, but actually it's a vocation. Yeah. It's a calling that people have.
The more you care, the better you are at the job.
Exactly, that would be my thinking. But I think quite often the culture and the processes and some of the challenges that I've talked about, it can almost knock the stuffing out of social workers. So after 5 years or so within the profession, I think some social workers will feel quite burnt out because of those working conditions and the challenges that I mentioned.
What role does race play practically in social work?
Okay, race affects social work in two ways, I believe. It affects service users, so children and families, young people, adults and so on. But it also affects social workers of colour. Because quite often social workers of colour are facing racism from service users, from their colleagues, from managers, from the employers or institutions they work in. And all of those things aren't acknowledged, they're not addressed, they're not in any way intervened with, and there's very little in the way of protection for social workers. There's not much space to offload. There's just an expectation, I guess, that social workers of colour get on with the role in the same way that their white colleagues do, which I feel is very unfair.
The race element, in terms, if we fit that into what we were talking about before, in terms of how social workers being burnt out and squeezed out of the role, making the entire service less effective.
Mm-hmm.
If there aren't measures put in to address the racism that social workers face,
mm-hmm.
the entire service that's being provided is undermined because you'll get more burnout because people doing the job aren't protected.
Exactly, and I would imagine that that's a factor in why there are issues around recruitment and retention of social workers, not just social workers of colour, but across the board, and why in some areas there's a real reliance or dependency on agency workers, which again impacts on service users because there isn't that continuity. They might have different social workers at different times for different reasons that are actually not the social worker's fault, whether they be black, white or any other ethnicity, but more about the organisations that they work within and the cultural practices and so on. There's a number of different outcomes from different research, there's different articles out there which highlight the disproportionate representation of social workers of colour in fitness to practice hearings with the social work regulator. There's also a disproportionate failure of what's called the Assessed and Supported Year in Employment, or ASYE for social workers. So social workers of colour are kind of meeting a barrier when they get to that in their first couple of years of qualifying. So there's lots of different hurdles and obstacles, effectively, which social workers of colour have to kind of try and overcome, but they're not necessarily protected or supported by the profession.
Tell me about your book, Outlanders.
Okay, so Outlanders is the hidden narratives from social workers of colour. It contains poems, essays and stories and miscellaneous works from various social workers across England, including myself. And that's my gift to you, that's your copy.
Thank you.
And yeah, I'm especially proud of that. I co-edited that with Siobhan McLean, who is a social worker also, but also a practice educator and publisher.
So if anybody was thinking, oh, you talk about this racism stuff in social work, but you have nothing to back it up, these are the stories that show how it affects people who work in that industry?
I think so.
Profession?
Yeah, and also there's a kind of cross-section in many ways of those experiences. So it's not all about racism, for example. You know, I'd like to think that there are some other topics that we cover, and there are various aspects of social work, because it's a hidden profession also, that I think we unearth. Many are women, because social work is predominantly kind of a female profession. There are very few males, especially males of colour, such as myself. So yes, there are stories of that. There are kind of insights into how the intersectionality of race and gender, but also sexuality and, you know, lots of other protected characteristics, how they affect some of those individuals. Primarily the emphasis is around race, but as I say, from an intersectional point of view, hopefully people can get something from it in that respect as well.
Absolute pleasure meeting you.
You too.